I'm Dr. Ash, and I'm back with more skincare tips. Today we'll be talking about retinol.
What is retinol?
Simply put, retinol is a vitamin A derivative. It's probably one of the best over the counter ingredients you could use for your overall skin health. It has a whole host of beneficial effects, namely increasing collagen in your skin, so it helps fine lines and wrinkles, and it also helps cell turnover, so it does help unclog pores, which in turn helps acne.
Does retinol reduce or prevent wrinkles?
It definitely does. So, one of the primary benefits of retinol and retinoids is that it increases collagen and elastin production in the deeper layers of the skin. So, as a result, it sort of plumps the skin and helps reduce fine lines and wrinkles.
I'm 30. Is it too early to start using retinol?
Definitely not too early to start using retinol. There are so many benefits to being on a retinol that honestly, I tell my patients it's really never too early to start a retinoid.
Does retinol cause acne?
No, it's actually the opposite. It helps acne. So, one of the benefits of it is that it increases cell turnover and increases skin proliferation. So, as a result, it helps keep pores unclogged. So, it actually reduces acne. One of the common things that patients get is a lot of irritation if they use it too frequently or incorrectly when they start using retinols. And sometimes that can be confused as triggering or making acne worse.
I have sensitive skin. Can I use retinol?
Yes, you definitely can. The key here, though, is to use it correctly. So you want to start using it only once or twice a week when you're initiating using a retinol, and then you want to increase from there. So then you want to do every other night, and then eventually work your way up to daily.
How do I incorporate retinol into my skincare routine?
So retinol should be used nightly or in the evenings because actually sunlight and UV does inactivate it. So you want to use it as a part of your evening routine, and you want to make sure to moisturize with it as well because it does cause some irritation upon initiation.
What is the difference between retinol and retinoids?
So this is a good question and something that I get asked a lot. So retinol is actually a type of retinoid, but the difference is retinol is over the counter and it's actually a less potent version of a retinoid. So there's actually a few steps before it's converted to the active form, which is retinoic acid. Whereas the difference is that with prescription retinoids, they're much more potent because they're already in the active state of the medication.
How long does it take to see results from retinol?
This is something I get asked a lot by patients because patients want to see benefits immediately, but it actually takes quite a while for retinol and retinoids to start having their effect because they're really working at the cellular level. So it takes about 6 to 8 weeks for patients to start noticing benefit with acne or fine lines and wrinkles.
Do you have any tips for using retinol?
I do. Retinol does cause a good amount of irritation in some patients, so it's really important to use a moisturizer when you start using a retinol. So, one helpful way to do this is the sandwich method. So, you put moisturizer on, followed by the retinol, and then another layer of moisturizer. Retinols do also cause a lot of sun sensitivity, so it's really, really important to use sunscreen when you start using a retinol. And then the final thing is it's really important to use it at night because UV rays and sunlight actually does inactivate it. So it won't harm you if you use it in the daytime, but it's just not going to be as effective.
Is retinol beneficial for dogs?
I don't know. Let's ask Kona. What do you think? I think she says it's only beneficial for cats.